Every 67 seconds, someone in the United States develops Alzheimer's or some form of dementia. This is life-changing not only for those who are diagnosed, but also those who are close to them. That is why today we are here at the Alzheimer's Association in San Jose to learn more about how to care for our loved ones that may be struggling with this terrible disease. Hi, I'm Kayla with Baylor Medical, and today we're here with Alex Morris at the Alzheimer's Association here in San Jose. Thank you so much for having us, Alex. It seems that caregivers go into this with little to no guidance and are oftentimes left feeling inadequate. What are some signs that caregivers can look for in the early signs of Alzheimer's, and how do they prepare for what's to come?
Typically, the first symptom is short-term memory loss, and I'm not just talking about forgetting where you put your keys or your glasses, but pretty significant. I forgot what you told me, and I keep asking and asking in the same conversation. I forgot that we spent the day together yesterday, so It's kind of big blocks of time, key information that I'm forgetting. So when an elder is having those symptoms, and I'm talking about someone over the age of 65, it's worthy of a doctor's appointment.
Okay.
It could be a lot of things, right?
Right.
But it's worthy looking into.
Okay. And what symptoms, so those are the early signs, what symptoms should they be preparing for?
Well, there's going to be, over time, it's progressive, a lot of confusion. And so it really requires the caregiver to be very sensitive to what's going on,
Sure.
Not to constantly correct. It's not their fault that they don't remember something.
Right.
So it really requires a whole new way of interacting, a whole new communication style for the for everybody who's interacting with the person with dementia. And that's a tall order.
Yeah.
We're used to reasoning with people, to get them to understand our point of view, to get them to do things that we need them to do. And over time, that just doesn't work anymore.
Right. Yeah, I would imagine that communicating with someone with Alzheimer's is difficult since their reality is just completely different from ours. Do you have any advice on the best way to communicate with them?
Absolutely. We actually teach entire courses on appropriate communication, and those courses are available nationwide. The Alzheimer's Association is available nationwide. But some basic tips is don't correct, especially if it isn't something about health or safety. What difference does it make what day it is, or even what year it is, or if I went to go see Susie, or whether it was Martha I went to go see. So I ask families, stop correcting. And when they want something to happen, when they want them to go to the doctor, for example, try not to make it about them. Like, Mom, I'm seeing these symptoms and I'm really worried. Now, initially that may work if it's early enough and the person isn't so scared.
Right.
But often that doesn't work. And so we soften it. We say, well, it's time for the regular appointment. I need to go to the doctor, and you should too.
So in your experience, what is one of the hardest things that a caregiver would have to go through, and what is your best piece of advice for them?
One of the most difficult things is when the person with dementia is accusing people that love them the most of stealing from them, or cheating on them, or taking advantage of them in some form. That's one of the most hardest things that family members go through. And my advice, even though it's easy for me to say as a professional and really hard for folks to do, is to think of it that the disease is doing this and not the person, and that this person is changing because of the changes in the brain, not because they don't love them or respect them.
Gosh, that would be really hard. I can't even imagine. Do you have any other resources besides this video that you can offer for caregivers to take advantage of?
Well, we have lots of education that's available in the community for both professionals, caregivers, and just the interested public. We have support groups that are available for caregivers as well as early stage folks with the disease. Also other early stage engagement. We offer advocacy services as well, and safety services that are available, which includes a Medic Alert Safe Return bracelet that's difficult to take off, so it's really helpful if a person should wander off and get lost. Also, the website has a lot of terrific information and interactive tools, as well as a caregiver section where you can get community resources, navigation tools about care planning, and that is www.alz.org.
Okay.
So alz.org, and using that website, a person could find the local chapter, the closest chapter to them.
So the phone number has all of the same resources available that the website does, but maybe for people that aren't so good with using the computer.
Correct.
Well, thank you so much for your time today. It was great meeting with you.
Thank you.
We will have a list of those resources on our website at baylormedical.com. And if you want any further information about this disease, please visit alzheimers.org. Thank you so much for watching.